not a doctor, but I can provide you with some general information on common risk factors associated with strokes and neurological problems. It's important to note that individual cases can vary, and consulting with a healthcare professional for personalized advice is crucial. Here are 10 factors that are often associated with an increased risk of brain strokes and neurological problems. 1. Hypertension. High blood pressure. Persistent high blood pressure can damage blood vessels, increasing the risk of strokes. 2. Smoking. Tobacco smoke contains chemicals that can damage blood vessels and promote the formation of blood clots. 3. Diabetes. Uncontrolled diabetes can damage blood vessels and contribute to atherosclerosis, a condition where arteries become narrowed and hardened. 4. High cholesterol levels. Elevated levels of cholesterol can lead to the buildup of plaque in arteries, reducing blood flow to the brain. 5. Atrial fibrillation. This irregular heart rhythm can cause blood clots to form in the heart, which can travel to the brain and cause a stroke. 6. Obesity. Being overweight or obese is associated with several risk factors, including hypertension, diabetes, and high cholesterol. 7. Physical inactivity. Lack of regular exercise can contribute to various risk factors such as obesity, hypertension, and diabetes. 8. Excessive alcohol consumption. Heavy drinking can raise blood pressure and contribute to other risk factors for strokes. 9. Age. The risk of strokes and neurological problems increases with age, with older adults being more susceptible. 10. Genetics/family history. A family history of strokes or certain genetic factors may increase the likelihood of experiencing neurological problems. It's important to adopt a healthy lifestyle, manage underlying health conditions, and consult with healthcare professionals for regular checkups and guidance on maintaining optimal health. Neurological problems encompass a wide range of conditions that affect the nervous system, which includes the brain, spinal cord, and peripheral nerves. Here are some types of neurological problems. 1. Stroke. A stroke occurs when blood flow to a part of the brain is interrupted, leading to damage to brain cells. Ischemic strokes result from blocked blood vessels, while hemorrhagic strokes involve bleeding in the brain. 2. Epilepsy. Epilepsy is a neurological disorder characterized by recurrent seizures, which are sudden and uncontrolled electrical disturbances in the brain. 3. Multiple sclerosis. MS is an autoimmune disease where the immune system mistakenly attacks the protective covering of nerve fibers, leading to communication problems between the brain and the rest of the body. 4. Parkinson's disease. Parkinson's is a progressive neurodegenerative disorder that affects movement. It is characterized by tremors, stiffness, and difficulty with balance and coordination. 5. Alzheimer's disease. Alzheimer's is a neurodegenerative disease that primarily affects memory and cognitive function. It is the most common cause of dementia. 6. Migraines. Migraines are severe headaches often accompanied by sensory disturbances, such as light sensitivity and nausea. They have a neurological basis and can be triggered by various factors. 7. Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a progressive motor neuron disease that affects nerve cells in the brain and spinal cord, leading to muscle weakness and loss of control. 8. Neuropathy. Peripheral neuropathy involves damage to the peripheral nerves, leading to symptoms like pain, numbness, and weakness, often in the hands and feet. 9. Traumatic brain injury, TBI. TBI results from a sudden, external force causing damage to the brain. It can lead to a range of neurological symptoms depending on the severity of the injury. 10. Huntington's disease. Huntington's is an inherited disorder that causes the progressive breakdown of nerve cells in the brain, leading to motor dysfunction, cognitive decline, and psychiatric symptoms. 11. Guillain-Barré syndrome. This is an autoimmune disorder where the immune system attacks the peripheral nerves, causing weakness, numbness, and sometimes paralysis. 12. Cerebral palsy. Cerebral palsy is a group of disorders that affect movement and muscle coordination, often caused by damage to the developing brain. These are just a few examples, and there are many other neurological disorders with diverse symptoms and causes. Neurological problems can have various causes, ranging from genetic factors to environmental influences. Here are 10 reasons that can contribute to neurological issues. 1. Genetic factors. Inherited genetic mutations or abnormalities can predispose individuals to certain neurological disorders. 2. Traumatic brain injury. TBI head injuries resulting from accidents, falls, or sports-related incidents can lead to neurological problems. 3. Infections. Certain infections, such as meningitis, encephalitis, or brain abscesses, can affect the central nervous system and lead to neurological issues. 4. Vascular disorders. Conditions affecting blood vessels, such as aneurysms, arteriovenous malformations, AVMs, or strokes, can cause neurological problems. 5. Autoimmune disorders. Conditions where the immune system mistakenly attacks the body's own tissues, such as multiple sclerosis or Guillain-Barré syndrome, can affect the nervous system. 6. Metabolic disorders. Disorders that impact the body's metabolism, like Wilson's disease or mitochondrial disorders, can lead to neurological symptoms. 7. Toxic exposure. Exposure to certain toxins, heavy metals, or chemicals can damage the nervous system and result in neurological problems. 8. Neurodegenerative diseases. Conditions like Alzheimer's disease, Parkinson's disease, and Huntington's disease involve the progressive degeneration of nerve cells. 9. Brain tumors. Tumors in the brain or nearby structures can interfere with normal neurological function. 10. Chronic medical conditions. Diseases such as diabetes, lupus, or certain thyroid disorders can have neurological manifestations. It's important to note that these factors are not mutually exclusive, and many neurological disorders may result from a combination of genetic predisposition and environmental factors. Blood clotting in the brain, also known as a cerebral blood clot or thrombosis, can lead to serious conditions such as stroke. Here are 10 reasons that may contribute to the clotting of blood in the brain. 1. Atherosclerosis. The buildup of fatty deposits, plaque, in the arteries can lead to the narrowing of blood vessels, increasing the risk of blood clot formation. 2. Hypertension. High blood pressure. Elevated blood pressure can damage blood vessel walls, making them more prone to clot formation. 3. Atrial fibrillation. An irregular heart rhythm can lead to the formation of blood clots in the heart, which may travel to the brain and cause a clot. 4. Diabetes. Uncontrolled diabetes can damage blood vessels and increase the risk of clot formation. 5. Smoking. Tobacco smoke contains chemicals that can damage blood vessels and promote the formation of blood clots. 6. Hypercoagulable conditions. Certain medical conditions, such as genetic or acquired clotting disorders, can make the blood more prone to clot formation. 7. Surgery or trauma. Surgical procedures or traumatic injuries to the blood vessels can trigger blood clot formation. 8. Dehydration. Inadequate fluid levels in the body can make blood thicker and more likely to form clots. 9. Inflammation. Chronic inflammatory conditions or infections can contribute to blood clotting. 10. Certain medications. Some medications, such as hormone-based contraceptives or hormone replacement therapy, can increase the risk of blood clot formation. It's important to note that these factors can often interact, and an individual may have multiple risk factors simultaneously. A stroke occurs when there is a disruption of blood flow to the brain, leading to damage to brain cells. Here are 10 reasons for brain strokes. 1. Ischemic stroke. This occurs when a blood clot or plaque block a blood vessel, reducing blood flow to the brain. 2. Hemorrhagic stroke, caused by the rupture of a blood vessel in the brain, leading to bleeding and damage to surrounding tissues. 3. Hypertension. High blood pressure. Persistent high blood pressure can damage blood vessels, increasing the risk of both ischemic and hemorrhagic strokes. 4. Atrial fibrillation. An irregular heart rhythm can cause blood clots to form in the heart, which may travel to the brain and cause an ischemic stroke. 5. Diabetes. Uncontrolled diabetes can damage blood vessels and increase the risk of atherosclerosis, contributing to the development of ischemic strokes. 6. High cholesterol levels. Elevated cholesterol levels can lead to the buildup of plaque in arteries, increasing the risk of ischemic strokes. 7. Smoking. Tobacco smoke contains chemicals that can damage blood vessels and promote the formation of blood clots, contributing to ischemic strokes. 8. Age. The risk of strokes increases with age, with older adults being more susceptible to various risk factors. 9. Family history. A family history of strokes or certain genetic factors may increase the likelihood of experiencing a stroke. 10. Previous stroke or transient ischemic attack. TIA. Individuals who have experienced a stroke or TIA are at a higher risk of having another stroke. It's important to note that strokes are medical emergencies, and early recognition and treatment are crucial for minimizing damage to the brain.
Seizures, commonly known as fits, can be caused by various factors. Here are 10 potential reasons for seizures. 1. Epilepsy. The most common cause of recurrent seizures is epilepsy, a neurological disorder characterized by abnormal electrical activity in the brain. 2. Brain trauma. Head injuries, concussions, or traumatic brain injuries can disrupt normal brain function and trigger seizures. 3. Brain tumors. Tumors in the brain can cause seizures by interfering with the normal electrical activity of the brain. 4. Stroke. A stroke, which can be either ischemic or hemorrhagic, can lead to seizures by causing damage to the brain tissue. 5. Infections. Infections affecting the brain, such as meningitis or encephalitis, can trigger seizures. 6. Metabolic disorders. Certain metabolic imbalances, such as low blood sugar, hypoglycemia, or electrolyte abnormalities, can lead to seizures. 7. Genetic factors. Some individuals may have a genetic predisposition to seizures, and certain genetic syndromes are associated with an increased risk. 8. Alcohol or drug withdrawal. Abrupt cessation of alcohol or certain drugs can lead to seizures as the brain adapts to the absence of the substances. 9. High fever, febrile seizures. Young children, especially between the ages of 6 months and 5 years, may experience seizures associated with a rapid increase in body temperature. 10. Environmental triggers. Certain environmental factors, such as flashing lights, photosensitivity, or specific patterns, can trigger seizures in individuals with photosensitive epilepsy. It's important to note that these are general categories, and individual cases may vary. If someone experiences a seizure, it's crucial to seek medical attention for proper diagnosis and management. A healthcare professional, typically a neurologist, can conduct a thorough evaluation to determine the underlying cause and recommend an appropriate treatment plan.